Imagine the value of a device that could see through a patient's skin and provide you a real-time digital map of their vessels, greatly reducing needle stick attempts and access time for procedures. Imagine the even greater value of a device that could help identify hidden valves and bifurcations, as well as visualize refill and flushing of veins and potentially help avoid infiltrations. Delivering an image you can trust to help you choose the most appropriate catheter size for improved dwell times. VeinViewer can also assist in visualizing the reaction of the vessel during the procedure. See a rolling vein. See fluid flushes to check patency, potentially helping you avoid an infiltration or extravasation. Post-access, VeinViewer is the only vein illumination device that can help you recognize a hematoma forming from a burst or punctured vessel, giving you the information you need to take action and potentially prevent additional complications. Make the VeinViewer choice and
continuous image of the subcutaneous venous map. The image is captured by an infrared camera. It is processed and projected back over the same spot on the skin almost in real time. It can show veins as deep as 8 mm. This was initially developed for finding veins, helping labs and hospitals to collect blood and establishing lines to inject medications. By using the VeinViewer, the impression we have as we examine the patient's leg is that the VeinViewer was developed specifically for phlebology.
By using the device to map vessel patterns pre- and post-treatment, VeinViewer can provide immediate information about the success of the procedure.
Another really unique use of the VeinViewer is to use it prior to filler injections. We can shine this light onto the skin in the areas that we'll be injecting filler, specifically around the eyes, nose, or mouth, where a lot of the major blood vessels are, and be able to identify where those are so that when we inject the filler, we do not inject any filler into the vessels or cause any damage to those vessels, causing a much safer procedure for our patients, much less pain, and much less risk of any bruising or swelling. Using the VeinViewer Flex will take you to the next level when it comes to filler injections, and you can advance your skills with much less risk if you're using a device like this.
I'm looking forward to finishing everything. Thank you, Dr. Hammer.
This is the laser applied under cooling, called the cryolaser. This shows the sclerotherapy under cooling, called cryosclero. Most of the times we can follow the vein disappearing. This shows the vacuuming of a clot. This shows the mapping prior to surgery. We foresaw this device as a milestone in phlebology, and after working for more than 2 years with it, we noticed that our practice has improved as well as our results. To exemplify that, we present the following case. By naked eye, we can see some feeder veins, but with the VeinViewer, we can see almost all of them. Here we see the VeinViewer guiding the laser treatment. Sometimes we won't see the ready collapse of the vein. Complementary, we perform cryosclero. On the second session, some veins still showed refilling. In this situation, we notice the enhancement of response, probably due to inflammation of the vein walls. Here, the attempt to perform cryosclero showed us that the vessel was actually closed. Always vacuum the occasional clots.